Hi, my name is Dr. Thomas Nguyen, and I'm a board-certified addiction physician. To review the role of genetic factors in the risk of developing substance use disorder, the genetic influences must compose of studies of families, twins, and adoptees. For alcohol use disorder, 40 to 60% again of alcoholism can be attributed to genetic factors. What is quoted in the literature for alcohol genetic liabilities, again, can be applied to opioids, to stimulants, and to nicotine or cannabinoids. It is found that children of alcoholics demonstrate a 5-fold increase in the development of substance use disorders in the future. Siblings of those who use alcohol and meet the criteria of alcohol use disorders demonstrate a 50% higher risk of developing alcohol use disorder in males and 25% in females. And I'll make that distinction between the gender differences later on. Because of the shared social and developmental influences being raised in the same environment as biological parents, there has to be a disentanglement from extracting the familial influences and the environment influences in order to decipher the role of the genetic contribution to the development here of alcohol use disorders. Because of this, twins are used, especially identical twins and fraternal twins. It is shown that identical twins have a significantly higher percentage of developing alcohol use disorder versus fraternal twins. Fraternal twins are twins, they are in separate placenta. So in identical twins, there is a 50% risk of developing alcohol use disorders, whereas it is 39% in fraternal twins. Because identical twins have exact genetic makeup, it implicates that genetic liabilities play a significant role in the manifestations of alcohol use disorders. But in those twins who are separated after birth from their biological parents to those adoptee parents, they found that those twins who are from biological parents with alcohol use disorders tend to develop alcoholism much higher, despite the fact that their adopted parents do not use alcohol. So which this means that it is more likely for those individuals who are an offspring of biological parents with with alcohol use disorders to have the higher liabilities of developing alcohol use disorders, whether they're in an adopted environment or they're in a biological environment. That risk is persistent. Whereas those who are from parents who do not have alcohol use disorders, even if they're raised in a family where the adopted parents are alcoholics, they do not have an increased liability in developing alcohol use disorder. Then what we have to understand is then now we can separate the environment, from the genetic implications, and we see that it follows the same thing, that you cannot escape your biological implications of the genetic impositions upon developing alcohol use disorders. There are also a distinction in subtypes of alcoholics. Cloninger et al. Have discerned and separated alcoholics into two types. Cloninger type number 1 shows that it is predominantly in female alcoholics, and the manifestation of heavy drinking does not present itself until after age 25. There is less criminality in these individuals with Cloninger type 1 alcoholism, and there is less sensation seeking and reward seeking in the type 1 Cloninger alcoholics. Type 2, however, are more predominant in males, and these individuals tend to have their first drink way before age 25, usually at age 14 or even earlier. They tend to have high criminality associated with this type of alcoholics, Cloninger type 2, and there's a high association between antisocial personality disorder and these individuals with Cloninger type 2 alcoholism. I hope this has been informative and useful. Thank you for your time.